According to a study published in the Journal of the American Medical Association, 82% of the U.S. population reported using at least one medication in the past week. In fact, that study found that 30% of people reported taking 5 or more medications. Due to an aging population, with a transition of prescription medications to over-the-counter and a trend toward outpatient service delivery, we know that outpatient medication use will increase. We need a surveillance system to help patients before they're admitted to a hospital. Adverse drug events in the outpatient world is a big problem. In fact, more than 700,000 patients seek treatment for a drug-related problem each year. Of those, 16% are hospitalized. More worrisome, though, is that there's an especially vulnerable population of patients. Patients who are 65 and older accounted for 1/4 of all the emergency room visits. So we spent time doing our research, combing through the medical literature to understand how to address this problem. And we made several observations. First, that most people have mobile phones and tablets, and that there was a real interest in using the devices that people already know and carry. From clinicians, we heard that tools were needed to streamline the process of sorting through patient calls, home visits, and ongoing monitoring. So, we first built a tool to capture symptomatology in a structured terminology. Patients can point to the region of the body where they feel a problem. Our application suggests the symptoms that are related to that part of the body. Symptoms displayed are focused on their medications and their diagnoses. Patients can report the intensity and frequency of their symptoms by sliding a bar back and forth. They can even add additional adjectives to describe the character of their symptoms. We make it easy for them to enter information by drawing upon an industry-proven database of symptoms, symptom clusters, and their relationship to medications and diseases, a knowledge base created by First Data Bank. When satisfied, patients can send their symptomatology to their physician's office for review. But behind the scenes, there's a lot more going on. First, we capture the information in a normalized taxonomy. Next, we score the symptom descriptions based upon what we know about medications, their side effects, their interactions, and the likelihood that symptoms might lead to severe harm. We prioritize the urgent patient alerts to the top. At the physician office, the clinical team can check through questions from patients as quickly as checking through email. The patients who require immediate attention are flagged. It's easier for the office to tell the patient where to go, whether to go directly to the emergency room or come into the clinic for an urgent checkup. The system can quickly communicate those instructions back to the patient. The system can file adverse event reports to patient safety organizations. And the system can enable clinic practices to better understand which medications are working well for them. Okay, so now the fine print. How do we build a system that will not cause harm? Patients who report symptoms are never turned away or given false reassurance. The tool helps a clinician to prioritize and identify whether the symptoms are medication-related or disease-related. A successful system will help clinics to respond better and faster. Sometimes it will avoid visits to local emergency rooms. Eventually, this system can prioritize and fill open clinic appointments, especially last-minute cancellations. When no clinical staff is available to respond, patients can still be given enough information and guided to seek immediate medical attention. We're building out a complete solution, customization and configuration capabilities to satisfy the special needs of individual physicians, clinics, and patients. You can set notification thresholds, customize symptom clusters, and dial up or down the level and type of automated responses. Adverse drug events account for 2.5% of all emergency room visits and 6.7% of all hospital admissions. Hospital admissions are a large factor, if not the largest, in driving up healthcare costs. We think that the big opportunity is to shift care from hospital settings to less expensive venues, and to catch problems early and before they require a hospital admission. The research shows that out of all the adverse drug events, roughly 60% were due to unintentional overdoses and adverse effects, and that 22% were hospitalized. We believe that based upon the early detection of symptoms, we can identify adverse effects before they become full-blown overdoses. That we can steer patients to the clinic instead of the emergency room or hospital, and that ultimately this will save our society significant resources while achieving better overall patient outcomes.